This research, titled "On a Scale of 1 to 10, examines painting's ability to articulate women's chronic pain utilizing metaphor. The project responds to the question, how can painting re-signify and decatastrophize the imagery and metaphors promoted in contemporary painterly representations of endometriosis? Communicating pain is an issue widely discussed in health literature, and the difficulty of communication is a prevalent issue for sufferers of endometriosis. Pain evades simple linguistic expression, thus encouraging sufferers towards imaginative linguistic frameworks, leading to a reliance on imagery and/or metaphorical language to describe their pain experiences. Artists with the condition have turned to imagery and metaphor to make visible, unseen chronic pain, thus the creation of an emergent field of endometriosis-specific art. However, the prevailing metaphors in this imagery present an issue. The employment of gore and totalizing metaphors generate reductive accounts of the varied experiences of the disease. This research examines the problem presented by an existing trend in metaphor and the rising semiotics of endometriosis, and aims to reconsider the imagery representing the embodied experience of the disease. By engaging complex metaphor, specificity, and image networks, this project reparatively creates new signifiers for endometriosis in painting. The clinical significance of metaphoric pain imagery in communicating experiences from patient to practitioner argues for the continued use of the metaphor in the elaboration of medical concerns. This practice-based research navigates the contemporaneous trend of physical damage metaphors by reparatively building specific metaphoric imagery that relays individual phenomena relating to the disease. The keywords for this project are endometriosis, metaphor, gore, decatastrophization, health communication, and semiotics. On a Scale of 1 to 10 aims to create a set of paintings that reconsider the semiotics of endometriosis in painting and how pain's relativity is communicated. Attempts to truly describe pain indeed appear as difficult as they are frustrating, yet the need to communicate is overwhelming. The invisibility and unfamiliarity of sensations caused by different types of pain have an impact on the ability to communicate pain. In diversifying representations of women's chronic pain, the project aims to promote effective communication of the condition for individuals experiencing symptoms. Through the use of metaphor, these paintings will create a network of discrete images that represent the different endometriosis phenomena, each constituting splinters of a condition with many complex iterations. This is based on the belief that signs distinguishing types of pain enable more constructive communication, that effective communication is found between recognition and use of a set of common, accessible principles, and the collaborative construction of meaning via a shared code. The metaphoric imagery is broken down into two main categories: descriptive pain metaphors and consequences of the disease, i.e. infertility. The purpose of this is to decatastrophize and expand the visual endometriosis lexicon. Historically, art has intersected with medicine as an educational tool for the body, where diagrammatic imagery provided clarity on visible conditions. As our tools progressed, the need for didactic artwork in the medical field fell. Today, artists like John A. Douglas use art to relay personal experiences with illness, primarily as a cathartic and communicative practice. In order to represent the abstract phenomena, i.e. pain, metaphoric and allegorical imagery are often employed. In Susan Sontag's Illness as Metaphor, she debates the danger of medical metaphors and argues that metaphors disrupt communicative clarity. Sontag's essay is heavily referenced in medical literature, as practitioners debate the value of metaphor in patient-practitioner interlocutors. On the dramatizing effect of metaphoric perceptions of illness, Sontag writes, "The solution is hardly to stop telling patients the truth, but to rectify conceptions of the disease, to demythicize it. This supports a decatastrophized and aesthetically privileged approach to the imagery. Aestheticizing imagery is discussed in Susan Best's Reparative Aesthetics, specifically regarding artist Rosangela Reno. Best looks at the art-making methods employed by Reno that recontextualize existing images and emphasize humanity and affect in their transformation. A key point noted in reparative aesthetics is the ability for aestheticizing imagery to counter desire to look away and to encourage watching. In emphasizing effect, the studio work seeks to reparatively re-signify the endometriosis experience and encourage engaged dialogue. Image can inform the language surrounding endometriosis. In clarifying his phrase, pictorial turn, Theorist W.J.T. Mitchell provides historical examples of the image as a pedagogical tool, listing both its points and counterpoints. This project can aid the creation of personal pedagogical tools, and Mitchell's analysis of the image's relationship to language in this context is useful to the construction of effective meaning in images. The key artists for this project can be divided into three primary groups: artists representing endometriosis, artists representing the body, and approaches to constructing meaning. Ellie Kammer is an Australian artist whose work depicts her personal experience with endometriosis. This work makes visible unseen chronic pain, but the imagery is singular and employs gore. This project responds not to Kammer's authorship of her own experience, but to the media's proliferation of these images as comprehensive visual guides to the experience of the disease. The totalizing imagery does not articulate the variation in symptoms between sufferers. Further, the metaphor of stabbing is not unique to endometriosis, thus it does not uniquely signify the disease. When a disease has no clear etiology or treatment, this lack of specificity can hinder diagnosis. This project seeks to contribute to the visual dialogue on endometriosis by emphasizing metaphor specificity, networking imagery, and depersonalizing the artist by removing the ill body from imagery. Artists Louise Bourgeois and Felix Gonzalez-Torres both express the body in their works through the removal of the human figure and construction of bodily metaphors. Felix Gonzalez-Torres exemplifies this in Untitled Perfect Lovers, wherein he circumvents literal bodily representation. The non-figurative approach to the two clocks representing bodies constructs a poignant metaphor. Non-inclusion of the literal body and the body of the artist does not remove them from the work, but can promote the metaphor as an autonomous object, i.e. that it is not so much the author relaying their personal narrative, but that it belongs to a collective. In creating a network of signs for the heterogeneous symptoms, sufferers may be better positioned to communicate their experience. This divergence from figuration is further informed by the writings and works of Thomas Jeppe and Abby Warburg. Jeppe is a contemporary artist that theorizes on methods of art making that avoid didactic imagery and instead diverge from the original field of inquiry on the belief that indirectness and allegory are more effective than didacticism in describing a situation, and elaborating its attendant concerns. Abby Warburg's Mnemosyne Atlas maps the pathways that create meanings across art history and cosmography. The visual, metaphoric encyclopedia traces events and develops information networks. These concepts of divergence and networking in artistic practice will inform the studio work. If endometriosis evades direct representation, then one proposed solution is to approach representation by painting everything around the subject. The primary research method is studio work that uses paintings as a way of re-signifying the experience of endometriosis-specific pain, and by expanding the scope of its associated metaphors. The primary methodologies are phenomenology and semiotics. Diagnosis is a form of pattern recognition. It starts with signs and symptoms, messages, that are interpreted across certain rules about syndromes or concepts of disease. The problem in endometriosis's pattern recognition is the indistinct or non-specific signifiers currently used in the description of symptoms. This project aims to develop a network of images, a pattern, that speaks uniquely and empathetically to the condition. This project considers painting as a form of sign production, as treated in Isabel Graw's The Value of Liveliness. The paintings layer simple sign drawings to help inform meaning. For example, in Like When You Twist a Towel to Make a Whip, the curling shape imposed over the twisting fabric, representing a specific pain metaphor, seeks to focus the audience on the purpose of the individual painting as it contributes to the network. In her essay, Graw reflects on painting's labor economy, noting its ability to compress and reflect life and labor outwards to be seen in an instant. Compression of a lifetime into images is valuable to the discussion on chronic pain and its complex iterations over decades, but moreover, what she describes as painting's unique ability to create signs and project liveliness to an audience makes it a preferential medium for this project. Clinical studies advise part of the studio work. Pain imagery data collected on women with endometriosis informs the aforementioned variety of experiences in images. The work Pressure to Party refers to a patient's description of her pain as a balloon pressing against her insides. It also informs clinically significant terms for successfully communicating pain. Semino discusses representations of pain and the phenomena of physical damage becoming a source domain, used to explain the more abstract neuropathic or chronic pain. This emphasizes the lack of available language to communicate the unique experience of chronic pain. To improve communication, it's not necessary to dismiss metaphors altogether, but rather to understand and catalog them in a way that people may find the metaphors operate to validate a feeling or view they already have, articulate something they have not been able to express before, or provide a new and helpful perspective. The significance of the research topic is its contribution to the dialogue surrounding women's chronic pain. The challenges of communicating pain is an issue widely addressed in health literature. Recent findings in studies on endometriosis's diagnostic process found that a majority of women felt dismissed when expressing their pain. Feminist medical literature has broadly observed the delegitimization of women's pain in medical encounters. For example, in studying the gender asymmetries of pain treatments, Kirsty Maltherud found communication issues affected the description of symptoms by women, resulting in illness being deemed undefined. This project informs language specific to endometriosis to improve the communicative ability of the sufferers. The studio work navigates the contemporaneous trend of gore metaphors and totalizing accounts of chronic pain. Endometriosis researcher Stella Bulo speaks to the significance of improving the scope of endometriosis's associated metaphors, and how mapping these sensations with complexity may indicate the pain being described is uniquely endometriosis, countering the frustration of misunderstood or misrepresented pain. Visual arts is well placed to contribute to the medical dialogue and historically has done so well. This project continues that history. In the creation of the aforementioned new format of endometriosis metaphors, a thorough lexicon can contribute to a better understanding between individuals and will expand available painterly images representing endometriosis.